All right, ladies. So this video um, is really just to try to give you some practical knowledge about healthcare, both from your perspective as a patient, which you'll have to deal with more and more the older you get, but also potentially from the perspective of a healthcare provider, because hopefully you'll have a career in that field one day, and you might have some questions now about how things work. And so we're going to look at this from the financial perspective. And I like to call this the adulting day because we're going to talk about some big stuff, some terms you've probably heard before, and hopefully clarify some of what they mean so that you can make sense of it as you get older and you start to deal with maybe paying for your own medical care more than you do now. So, in my opinion, it's really hard to have a class about medicine and not talk about the financial side of things. Obviously, people are usually most interested in how much money a physician makes, or a nurse practitioner makes, or a dentist makes, or those kinds of things. And what we can say for certain is that a career in healthcare is a really good career that will give you a solid income. Various specialties of doctor or nurse practitioner are obviously going to make more money than others, but all of them also have a lot of expenses, and this is something that people don't think about very much, is that the running of a healthcare business is a very expensive endeavor. You have equipment costs, you have labor costs, you have costs for coworkers if you run your own business. And these costs are as high as those seen in pretty much any industry in the world. So to operate a hospital or a doctor's office is also very expensive. And so this is why, as I'm sure you already know yourself or from talking to your parents and things, medical bills can be really costly. So what we have to talk about when we talk about the United States healthcare system is insurance. And I know that you guys are aware of insurance and its existence, but when I was in high school, I didn't really understand how insurance worked that much. And so I thought it would be helpful to kind of talk about what that is and then how it factors into healthcare. So, first, just kind of in general, what is insurance? Or we're not even saying medical insurance at this point. We're just saying what is insurance. And so I looked this up right on the internet, and this is the definition I got. It is an arrangement in which a company or government agency provides a guarantee of compensation in a particular circumstance. So, what does that mean, right? What that means is that you pay a company, right? And then that company provides a guarantee of compensation under a particular circumstance. In other words, this is a way for an individual like you and me to avoid catastrophic personal financial loss. In other words, this is a way for you to avoid losing all of your money, right? And so, if you have something that could be extraordinarily expensive that could happen, you might have insurance to help cover that. So, for instance, something that all of you guys have, I'm sure, is automobile insurance, right? Car insurance. You have car insurance that protects you so that if you were in an accident and you had to have your car worked on or replaced, insurance might help pay for that versus you having to do all of that just from your bank account. Another instance with auto insurance is maybe there's an accident and someone gets hurt. Insurance might help pay for those bills that are incurred instead of you having to pay for that out of pocket. Another thing that a lot of people have insurance for, and I'm sure your family does, is home insurance, right? The worst thing you could think of is maybe a fire that destroys your home, right? And while you wouldn't be able to replace a lot of really personal things that would maybe be lost in that circumstance, if you have home insurance, then instead of you just now being without a house, you might have an insurance company that can come in and help you to purchase a new house, right? And they help pay for that. Now, in order to have this, you obviously have to be paying them along the way. So it's sort of like insurance takes gambling out of the way, right? You pay them, and hopefully you never need them. But if something big happens, then they come in and help you pay for stuff. Now, in terms of the U.S. healthcare system, we have two types of insurance. One type applies to all of us, and that is health insurance that we carry as patients. But the other type is called medical malpractice insurance, and you've probably heard that as well, which a healthcare provider carries to protect him or her from this kind of financial loss. So let's kind of delve into both of these things. Before we get into the specifics of health insurance versus medical malpractice, there are some terms in insurance that you've probably heard before, and you may or may not have had any idea what they were talking about. So I wanted to hit these four terms because these I think are the big ones. The first term is premium. All right, now this is the price of insurance coverage that you pay up front. So this is the price of insurance for a specific risk for a specific time. So, for instance, you might pay a premium monthly for health insurance. For a lot of people, your health insurance premium is taken out of your paycheck. So you never really even see that money. It just goes directly to that health insurance company. A lot of times we pay for auto and home insurance maybe like quarterly. So you might pay a premium every 3 months to the insurance company. But basically, you are paying the insurance company to cover you under certain circumstances for a certain amount of time. So, again, if you're paying a premium from month to month for health insurance, then that premium covers your health care costs for the next month. Now, there are a lot of factors that determine your premium. One factor is the company that you get your insurance from, but other things factor in too. So, for instance, age. The older you are, the more likely you are to need health care. So, your premium is probably going to be higher, right? Sex. Believe it or not, females are going to pay a little bit less than males because they say that males have riskier behavior and all that sort of stuff. And this is true both in healthcare and in auto insurance. Your overall health. If you do some things like, say, smoke cigarettes, and you disclose that to the insurance company like you should, then they might charge you a higher premium because that sort of risky behavior, smoking, makes it more likely that you're going to need health care. Sometimes they look at something that I think is a little bit unfair, but they look at the makeup of an entire group. So, for instance, health insurance at Mercy is available through Mercy and the Archdiocese of Louisville. And so that covers a big group of like teachers and staff from all these different Catholic schools. If the group is kind of older or has had a lot of healthcare concerns, then that might mean that your premium or my premium is higher too, just because of the whole group. And there's a lot of other stuff that goes into that too. Second thing is deductible. This is a word that I'm sure you've heard, but maybe one that you didn't really know what it meant. Deductible is the out-of-pocket costs that a person has to pay before their insurance will pick up. So, for instance, let's say that you have a deductible of $1,000 per year. What that means is that you have to pay, so basically you pay all costs up to $1,000. And then after you've paid $1,000, your insurance kicks in and starts to cover all or part of your expenses. So for a lot of people who are young and healthy like you guys, you don't even meet your deductible, right? You don't spend $1,000 a year going to doctors and medicine and whatever else. But the older you get and the more health concerns you have, you really might. And then, a great example I can give you is for young, healthy people needing, when might you need health insurance? an example for you young ladies is pregnancy. All right, so if you choose one day to have a baby, that's a pretty expensive thing. You got to pay doctors quite a bit. You got to pay to stay at the hospital for a couple days, and so that definitely can meet your deductible. So what I can say is that, my wife and I, knock on wood, are pretty healthy young adults. Neither of us has really ever met our deductible except for the 2 years that my wife had our children. And in those years, we definitely paid a decent chunk of money out of pocket, and then it went beyond that, and the insurance covered most of everything else that went along with having a kid. Now, the third thing is a co-payment or co-pay. You've probably heard this before too, and you might kind of know what this is. This is a set payment that you have to pay, generally like every time you have health care. And it must be paid before any kind of insurance payment. So, for instance, maybe your health insurance, when you go to the doctor, you have to pay a $20 copay or a $25 copay. And what that means is that at the time of service, you've got to pay that doctor $20. And then later, they'll bill you more, or they'll bill your insurance company more for whatever you had done. And the last one, I'm spending too much time on this slide, I know, is called a pre-existing condition, and you might have heard this before too. Sometimes an insurance company calls this a limit in coverage. Basically, this is kind of a controversial thing, but what this means is that if a person gets new health insurance, but they had a previously diagnosed problem, the new insurance may choose not to cover that issue moving forward. So what does this mean? Let's say that you have this person and they unfortunately had a stroke, right? And it left them with some long-term issues moving forward. Well, then let's say that they change jobs, and so they have to change their health insurance. And when they do, the new insurance calls their stroke and any side effects and problems that stem from it a pre-existing condition, and refuses to pay for healthcare needs associated with that. This happens sometimes. Today it's more common that just they're going to charge that person a really high premium versus have a pre-existing condition issue. But obviously this is confusing, and it gets deeper and deeper and deeper and deeper as well. So that's as deep as we're going to go with this stuff. So let's start out with medical malpractice insurance. So if you're a doctor, right, you have to pay a premium, again, monthly, quarterly, every year, whatever, for a given amount of coverage. So maybe you pay a premium which covers you, up to $5 million in malpractice insurance. Now, the premium you pay, so the amount that this doctor has to pay every month, depends on the type of doctor they are. The riskier the specialty, the higher the premium. So, riskier specialty equals higher premium. So, for instance, a general practice doctor or a pediatrician just sees kids that are sick with colds and stuff. They have low premium, and they generally don't have to carry as big an amount of coverage. But somebody who delivers babies, a surgeon, these doctors do much riskier things, where it's much more likely that they're going to see a patient who loses their life. ER doctors would be another example. They're going to pay a higher premium and need a lot more coverage. Now, what generally you see is that those kind of riskier specialties, they also make more money, so they have a higher income, but then they also have to pay more for their malpractice insurance. Now, how does all this shake down? If a medical malpractice case comes up, the insurance will settle with that plaintiff, that patient, on the doctor's behalf. So if a patient believes that a doctor did something wrong, the doctor brings in the insurance company, and instead of the doctor having to pay that person, out of pocket themselves, the insurance company will settle with that person and potentially pay them based on their claim. Now, why is this important and why is this good for a physician? The first thing here is something that was said to me by a doctor during my first year of med school. And he was an ER doctor, so he did have a different way of looking at things. But he said, it's not if you'll get sued as a doctor, it's when and how often. Now, particularly for ER doctors, this happens a lot because, they see a patient for a very brief period of time, and they are expected to know what's going on. And so an ER doctor can very often miss things, right? They can send a patient home and, thinking that it is one diagnosis and then find out they were wrong and the person gets worse. And so ER doctors particularly get sued a lot. But the reality is doctors get sued a lot. And you don't want that to cause, catastrophic financial loss. You don't want someone to sue you for millions of dollars until you lose all of the money you have. So you have insurance. In the event that that happens and you do get sued, the insurance helps to cover that. Now, do notice I made a note here. Insurance will not help you in losing your license to practice medicine. So if a doctor really screws up, that doctor could have the insurance's help from the financial standpoint, but the doctor could still be in big trouble and lose his or her license and no longer be able to practice medicine if they make a really, really big mistake. Now, health insurance. How does it work for a patient? So this is now what you and I have, or what I have to cover my cute little kids here. So basically, the patient pays a premium to cover medical expenses. Some jobs will actually pay that for you, although that's becoming more and more rare today. Oftentimes, your employer will help you pay for health insurance and provide you with a health insurance option. Now, then, throughout the year, you go to the doctor and maybe you have to have a little procedure done here or there. And once you pay enough to meet your deductible, then your insurance will kick in and they will cover a percentage of your medical costs. Sometimes insurance will cover 100% of a medical cost. Sometimes it'll only be a smaller percentage. But essentially what happens is the insurance company pays the doctor. So instead of you having to pay the doctor, you don't get a bill, but the doctor bills your insurance and the insurance pays it. Now, why is this good for you? Obviously, the need for medical care is really difficult to predict, right? And so, again, any kind of insurance helps you avoid catastrophic financial loss. So if you have a completely unpredictable major medical issue arise and you have to have a surgery and you have to spend time in the hospital, this can be really, really expensive to the extent that it costs more than all the money you have, right? So this is where insurance is so critical, right? If something happens that you weren't expecting, hopefully your insurance can kick in and cover a lot of those medical expenses instead of taking every penny that you have. The reality is these major catastrophic expenses are almost impossible to plan for. I mentioned the example earlier of having a baby. You can kind of plan for that, but otherwise, nobody knows when they might have a heart attack or a stroke or be in some sort of accident. You guys probably still remember Mr. Protenick, who just retired, and he had a heart attack a couple summers ago. And when I had the chance to talk to him afterwards, the main thing he said was, I felt fine, and then that day it was bad, and you just can't see it coming. And that's I kind of thought of this stuff when I talked to him, because it's true. You usually can't see those things coming, and so insurance will help you cover any kind of expenses that you end up with. Now, when we look at health insurance, the positive is that it's there when you need it, right? It's good for you because it helps you whenever you need it. But most people fixate on the negatives of health insurance. And so some of the complaints that you've maybe heard your parents say before, and these are all realistic things though, right? Health insurance is really expensive. Premiums vary widely, deductible amounts vary widely, and certainly some people have access to better health insurance plans than others depending on their jobs. Health insurance is really confusing, right? It can be difficult to understand what's going to be covered and what won't be covered. Most insurance won't help pay for anything that's elective. So if you choose to have a surgery that they don't really think you need, then a lot of times insurance won't pay for it. So maybe some kind of surgery to help open up your sinuses so you can breathe better. And a doctor might recommend that for you, but the insurance might not help pay for it because they don't think you really need it. Also insurance plans are accepted by some doctors and dentists and things and not others. And they might have in-network doctors or out-of-network doctors. So, for example, I have insurance through my wife who works for Norton Hospitals. Well, our insurance will pay more if we go to a Norton facility or if we go to a Norton doctor than they will if we go to a non-Norton facility or non-Norton doctor. So that stuff can be confusing too and frustrating if you have a doctor and then all of a sudden you can't really go to her anymore because your insurance doesn't help you there. And then a lot of people think health insurance is unfair, and it's definitely easy to find examples of that. Sometimes it's really hard to understand why an insurance company won't cover something, particularly in children. A lot of times there might be some sort of procedure that you feel like your kids need, but the insurance won't help pay for it. But really, they have their reasons, and there's a lot of statistics that go into insurance, and they stick to those numbers pretty solidly. And so, for a lot of times, it can feel really unfair to us as patients, but they kind of have their research and understand things, and sometimes that doesn't jive with what people would really like to have done. Now, what I also want to talk about for a moment, though, is something that you rarely ever hear, and that is the doctor's perspective or point of view when it comes to health insurance. Because the reality is that health insurance is something that is confusing for doctors as well. And while they probably want their patients to have health insurance, a lot of times they think of it as a necessary evil, is the term we use. The reality is, in the United States healthcare system, if a doctor or dentist wants to be sure that they'll get paid, they want their patients to have health insurance, because if the patient doesn't, it's really hard to guarantee that the doctor will get paid for services that are rendered. So again, if we're talking about my little kids here, here's Charlotte, who's very proud of her Supergirl headband and tattoo, and Eric, who's not as proud of his Green Lantern goggles or whatever was going on here. You go to the doctor and man, they charge you a crazy amount of money sometimes, and it just seems nuts even. The kind of numbers that you might see on a medical bill. You see that doctor for 5 minutes, and then you see a bill later, and it says that they charged you $250 for medical advice or whatever for those 5 minutes. And so usually patients and people just think, wow, that is nuts, and why would that doctor do that? And these doctors are evil people because they charge so much money. But the reality is doctors charge what they do in response to insurance. And so sometimes it's a little bit confusing, but I'm going to try to make it make sense for you. So basically, an insurance company determines how much a doctor can make for a particular procedure. So, for instance, let's say that I'm going to have I'm going to have a mole removed at the dermatologist. Okay, we just talked about skin cancer. So the insurance company might say that to get a mole removed, a doctor is allowed to be paid $300. And here's the first part that's kind of crazy, again, from the doctor's perspective, is that the insurance company can change that whenever they want. So essentially, tomorrow, if they decide that you can make $350 for removing a mole, they might bump it up. Or maybe tomorrow they'll decide that you can only make $250 for removing a mole. Now, if I'm a doctor and I charge $200 to take off a mole, and then that gets turned over to insurance, the insurance is going to give me $200. But if I'm a doctor and I charge $400 to remove a mole, and I turn that over to a patient's insurance company, the insurance company will pay me $300. So in other words, for a doctor, it makes more sense to always overcharge. That way you know that you'll get the maximum allowed amount from insurance instead of coming in under what you could actually make for it. Now, it's a whole different discussion about, what is what are medical procedures really worth. So a lot of people just think that all those numbers are too high, and I would maybe tend to agree with that. But any which way, if you're the doctor, you want to get paid as much as you can for the work that you do. And so what they'll do is they'll intentionally overcharge your insurance company to make sure that they get the full amount that the insurance company is willing to pay. Because if they don't charge more, the insurance company is just going to pay them that lesser amount. Now, unfortunately, and I don't want to spend too much time on this, there is a lot of government involvement when it comes to healthcare, and that's true everywhere, but certainly the U.S. is no exception. A couple of the different things that we do see in our society, you've probably heard of Medicaid before. Medicaid is both a federal program and a state-funded program that provides medical care, medical insurance for low-income and needy people. So it covers impoverished, it covers the disabled. And in 2017, I didn't look up 2018 numbers. I don't know if they're even out yet. This was 72.5 million people in the United States were covered by Medicaid. And so in some cases, we're talking about folks who are in poverty, but we also are talking about folks who basically just could not have a job maybe. So for instance, I have an uncle that I'll talk about more later this year too, but he is mentally handicapped, and so he has Medicaid because he cannot possibly have a job. He's almost 50 years old, but he basically has the cognition of a 4 or 5 year old. So because he can't hold down a job and have any kind of income, he is supported through Medicaid. Now, the reality is that Medicaid is very complicated in how it works, and realize that most of the people who need it are undereducated or are handicapped in some way, and so that makes it that much more complicated or troublesome at times. Now, we also have Medicare, which you've probably heard of before, too. Medicare is a federal health insurance program for older people. So age 65 and older can qualify for Medicare. A lot of times today, people will have Medicare and other health insurance as well. Like that's what my parents do right now. Since my parents still work, they both qualify for Medicare based on their age, but they also still have health insurance through work as well. And as you might guess, this is also a pretty complicated thing with lots of paperwork and all that stuff. Now, without getting to anything controversial, hopefully here, because I don't want it to be a political thing, we also now have the Affordable Care Act of 2010, which a lot of times people refer to as Obamacare. Obamacare was legislation whose goal was to provide, affordable health care for all Americans. There's a lot of different pieces to the Affordable Care Act. It's very complicated and actually beyond my understanding of that sort of stuff. But ultimately what Obamacare did is it made it so that everyone in America had to have health insurance coverage. And if you didn't have some kind of health insurance coverage, you would have to pay a penalty on your taxes. And so in 2010, they set up these marketplaces for each state where people who didn't have insurance through their company or through their work maybe could go and get affordable health care. And essentially how those marketplaces worked is, your income determines how much you would pay. So it's government subsidized healthcare, meaning that the government might cover part of the cost if you have a lower income. Kentucky was actually praised for having one of the best state marketplaces. I don't know if that's still true or not, but it was true back in 2010, 2011 when all this stuff started. Now, here's Charlotte, who really loves Holiday World. But Obamacare, has its pros and cons. A lot of it is politicians disagreeing in things. But, the reality to it is this. Obamacare requires people to have health insurance. And this is important because the majority of medical facilities in the U.S. are not going to turn away somebody who needs care, who comes in to see them. And there was other legislation back in 1986, which was before you guys, which basically required hospital emergency rooms to provide emergency medical care regardless of whether someone could pay for it or not. And the issue with this becomes, what is really an emergency? And so you guys may have heard these sort of things, that today a lot of people will go to the emergency room with a cold just because they don't have a primary care doctor. And so the question becomes, what's an emergency? And the reality that we faced, in 2010 and still today and long before that too is, if half the people who go to the ER cannot and ultimately will not pay for the services they receive, what's that do to the hospital, and what's that do to the other half of the people who can pay? And the reality is, it makes the price go up, right? If some people aren't paying for their services, that's costing the hospital. So the hospital is going to charge more. And then those people who can pay for their health care are going to have to pay those higher prices. And so what a lot of people thought and still think today is that, the reason healthcare is as expensive as it is actually has a lot to do with the number of people who were uninsured for a long time in the United States. And that's what Obamacare tried to fix. But a lot of people disagree on how to fix it. And today things are a little muddier. The Trump administration sought to remove and repeal and get rid of Obamacare completely, but then the Republicans didn't really have a good replacement for it, so it's technically still in place right now, but it had some tweaks to it and things too and stuff. So that's just always something you can follow as to kind of what the Affordable Care Act looks like right now. Now, just really quickly, because this is getting too long, other countries have very different healthcare than we do, and they really do. They vary across the world. If we look right to our north in Canada, they have what's called universal healthcare. So they have socialized medicine, meaning that medicine is a publicly funded thing by their government. So every citizen qualifies for healthcare from essentially government caregivers, and it's free. So on the surface, this sounds awesome, right? Healthcare is free there. You go to the doctor and it's covered, but you do end up with a lot of issues. The government sort of tells you what doctors you can go to, so you don't have quite as many choices as you do in a system like ours. You can, in Canada, still choose to get private health care and pay for it yourself and go to doctors who provide private health care. But as you might guess, that becomes super expensive, and it's really only available to the wealthy. And then the problem with something like socialized medicine is that you end up with some really long wait times. And I don't mean like you go to the doctor and you sit in the waiting room for an hour. I mean, if you need a knee surgery, you might actually be able to get that knee surgery for free. But you might not be able to get that knee surgery until 2 years from now. because of how busy surgeons are. It sometimes isn't the best thing in the world, even though free healthcare often sounds good at the outset. And ultimately, the biggest question that we want to ask, particularly at Mercy, where we don't want to lose sight of social justice issues, is access to healthcare, right? Access to healthcare for people is one of the biggest issues in any kind of medical system. Because the reality is that there are going to be people who don't qualify for certain assistance programs like Medicaid, but they really can't afford health insurance coverage. And so you do have to have ways to provide them health care as well, just because of the dignity that people deserve. And so you generally do have public health departments in counties or cities which work to prevent disease and keep people healthy. But those kind of departments are only funded so much as well. And so the question really becomes who kind of deserves the most help. So as you guys work your way through service, both in the junior year and the senior year, always kind of keep that in the back of your head. So whatever your topic is that you look into with senior service, what are the access to healthcare issues that people might have in your focus group that you're focusing on? And when you're in junior service and you're looking at systems, think about how the legislation that's out there makes it easier or harder sometimes for people to get access to healthcare. So I know this is a lot of deep stuff. So hopefully this was a little bit informative and some things make sense to you now that you'll need later on in life. But ultimately, much like a lot of stuff this year in clinical medicine, this is not something that'll be on a test, but hopefully it's just good practical knowledge for you to have. So thanks for listening.